Hello and welcome. I'm Steve Clemons, Editor-at-Large of The Hill. Thanks so much for joining us for our forum today titled Making Medicare Work Better for Patients. Before we begin, I'd like to thank our sponsor, Pharma, the Pharmaceutical Research and Manufacturers of America, for supporting today's event. We'll be taking a close look at the current debate surrounding Medicare modernization and what that could imply for patients. How do we cut costs for patients while also encouraging drug innovation, research, and development? Should the government be able to negotiate drug prices in Medicare? And what is lost if they do? What can Congress do to lower costs for prescription drugs for seniors and people with disabilities? And how can Medicare be improved to help patients access care and afford their medications? Before we bring on our fantastic speakers to these questions and more, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillMedicare. That's a first for us, The Hill Medicare. We're broadcasting live and we'll be taking your questions throughout the program. As with any live stream, and I always laugh at this, they say, you know, if you have any troubles, just refresh the page and it should fix most of your problems. It occasionally works for me. I'm sure it will for you. We're now kicking off the program with the newly minted Deputy Administrator and Director of the Center for Medicare, Dr. Meena Seshamani, excuse me, Dr. Seshamani. Dr. Seshamani, please excuse the butchering of that, but it's so great to be on with you today. Thanks for joining us. Look, I'd like to just sort of start out asking, you know, when it comes to the social contract with patients and the importance of Medicare, which you're running, I'd like to know for you, what do you feel needs to be tweaked or changed when it comes to delivering high-quality health outcomes that we're not doing today from your perspective?
Well, thank you so much, Steve, for inviting me to be here with you today. And certainly it is an honor to lead Medicare during this pivotal time for our nation's health. And, you know, to your question, Medicare certainly has a central role to play in President Biden's vision to build back better. We must advance health equity, drive high-quality person-centered care, and promote affordability and sustainability. And we must do this through Original Medicare, Medicare Advantage, Part D drug coverage, and our transformation initiatives through our Innovation Center. These principles are evident in some of our recent rules. So, for example, we made a commitment to increasing data on health disparities in our proposed inpatient prospective payment system rule, with a particular focus on maternal morbidity and mortality, which we know particularly impacts women of color. We've also expanded access to telehealth services for beneficiaries who have behavioral health needs in the physician fee service fee schedule proposed rule. And I can say personally, as a physician, I know the difference that leveraging telehealth has made for our patients and our providers. For example, enabling someone who previously had to take multiple buses and spend hours to get to clinic, instead being able to engage from their home. And we're also increasing enforcement of our hospital price transparency regulations so the market will have the information it needs to improve competition. Now, to one of the areas you mentioned, prescription drugs is an important area for us to address. Americans pay 2 to 3 times more for their prescription drugs than people in other wealthy countries, and nearly 1 in 4 Americans struggle to afford prescription drugs. President Biden's Build Back Better agenda calls for the lowering of prescription drugs for Americans by letting Medicare negotiate drug prices. And this is something that is overwhelmingly popular and bipartisan. I also firmly believe that we must continue to innovate in our programs. So thanks to the Affordable Care Act, the Center for Medicare and Medicaid Innovation has been testing ideas to bring better health care to beneficiaries in a more affordable and sustainable way. And we in the Center for Medicare will partner very closely with them to bring about truly innovative solutions to some of our major healthcare challenges. And I say all of this from my perspective and experience also as a physician who has very recently taken care of patients. I have seen firsthand the impact on patients, on their families, on their communities when the system doesn't work for them.
Right.
I am committed to ensuring that we will achieve these objectives in partnership with our beneficiaries. They really do have to be at the center of everything that we do.
Well, Dr. Seshamani, one of the things I have learned in this field after having done probably hundreds, if not thousands of forums, is that there are lots of shades of gray. There are a lot of nuances, a lot of fragility. And you were just talking about, one of these issues that I've been reading different sides, actually, and it's like gravity working different sides, about government being the one to negotiate with industry on the price of drugs. And some say when that some argue as the Kaiser Foundation found that that's popular. If you look at Morning Consult, you find a lot of people kind of have a slightly different view. The Morning Consult poll, has people worried that, perhaps some of the access they have, the robustness of access they have, that would be more fragile. And so I'm just wondering whether we are looking for formulas of approach that may undermine what has largely been working at a level. And I'm just wondering, whether you're sensitive to those dimensions as well. This is, Disability Pride Month, and I've been reading a bit that those that are disabled are worried if you were to change that formula, a lot of the access to the drugs on the disabled front, that foundation might become more wobbly.
Well, I think high-cost prescription drugs remain a significant challenge for the nation, as well as for Medicare beneficiaries who rely on these therapies to prolong life. A lot of the work in our innovative care models that are trying to improve people's health, avoid unnecessary hospitalizations, avoid ED visits, if the prescription medications that people take to stay healthy are expensive or unaffordable, this presents a huge barrier to people being able to stay healthy and for all of us to make progress on in improving our system. Sure. So I think that we need to consider, access, quality, affordability all together as we are evaluating, how we move forward. And certainly, all options are open.
Right. Later in the program, we're going to have Randall Ruzza, the CEO of the National Health Council. I'm really looking for, so maybe this is appropriate for him. But sometimes I wonder, could we just have a dinner? I mean, this is going to be really naive. Get our friends from the pharmaceutical industry, get the insurers, get the pharmacy benefit managers, get various players, get the generic, and then have a discussion, get patients, back in this, and discuss this ecosystem of how we can actually achieve better health outcomes in the system at prices that make sense for people at the corner. And so I'm just wondering, when you kind of look at this, and oftentimes we're looking at drug brand names, but insurers and deductibilities, the deductibles are part of the story. PBMs are also part of the story that are negotiating the price, and some are saying, hey, a lot of that money that they're saving with this is not ending up rebated or in the pockets of the patient where it might land. And so I'm just wondering whether we need to broaden the aperture a bit when we talk about affordability of drugs, and are there not other I don't know how to put it, complicit parties that we should be bringing into this?
Well, I mean, certainly the direction provided in President Biden's executive order on promoting competition in the American economy, really calls on working around the pricing of prescription drugs and biologics, enhancing domestic pharmaceutical supply chains, et cetera. And so where we can really try to achieve value in our healthcare system, really support people to stay healthy, really spend money in a smarter way. These are all the tenets that we have to take with us moving forward. And again, to come back to the theme of this event, making sure that people are at the center here, that people are able to stay healthy, that they're able to afford their treatments, and that they're able to stay well and enjoy life and be with their communities, et cetera. So I think really being able to keep that true north in mind is very important.
I love that vision. And along those lines, one of the odd moments, and I'm just waiting really desperately to actually see the text of this infrastructure bill, which we're all waiting to hear from and to see what's included. But there are a couple of tremors out there that think that some of the elements that might have been in your department that could help those patients get greater rebates or returns, at the drugstore counter, maybe something that they draw money from that to help pay for the infrastructure bill. Is there truth to those rumors? Do you know the status of that as this bill is being negotiated?
I can't speak to any of that. What I can say is that I look forward to continuing to work on these issues and look forward to partnering on them.
Well, that's a great answer. And I can tell you're having fun in this job. But we've got a couple of questions from our audience, and I want to ask Paul. Paul?
Hi, Paul Kelly here with the Livingston Group, a lobbying firm here in Washington. Thank you, Steve. I want to congratulate you and the Hill newspaper for once again having a great webinar on a really important healthcare topic. I wanted to ask about value-based care. There's been such an emphasis in recent years on value-based care in Medicare and other healthcare systems rather than the old fee-for-service system. I'm wondering if the panelists think that that's going to continue, what incentives might be put in place to help that be successful, and most important, whether that's benefiting patient care. Thanks.
Thank you, Paul. Good question.
Yes, thank you, Paul. Certainly, the Center for Medicare and Medicaid Innovation has been transforming both Medicare and Medicaid to improve the delivery and payment of care. And, especially through accountable care organizations where we can have people involved in having quality and accountability for the cost of care together. Certainly, programs such as these will continue to be utilized in the Biden-Harris administration to bring about really innovative solutions. And as the Center Director for Medicare, I really believe in a very strong partnership here where we can work together across the continuum of care, thinking about how we can have the person at that center. This also gets to issues of health equity. How do we make sure that we are addressing how we can best support people and keep people healthy and really have the health system work for them? And we can do that through a lot of these innovations that really run the gamut from, some of the models in CMMI to some of the ways that we work in the day-to-day runnings of our programs.
Well, thank you. We have a question that's come in by Twitter from someone I have great respect for what he's doing, this Congressman Patrick Kennedy. And Patrick Kennedy writes, please ask why the Medicare fixes out there don't include mental health and addiction coverage despite soaring overdose numbers and documented health impact of COVID. Is brain health not health? I think that's an important question and thought in as we sort of begin looking at, what we were beginning to do to look at wellness, look at value-based care, look at the efficacy of treatments and whatnot. Shouldn't mental health somehow be within the sandbox that you have direction over now?
Absolutely. And in fact, in the physician fee schedule, we have expanded telehealth services for behavioral health needs. So certainly behavioral health is front and center. As mentioned, this really has come to the fore with the pandemic, but was really there beforehand as well. And so this is something that we will continue to focus on.
And Dr. Seshamani, another question that has come in by Twitter, and that's been something I really don't know very much about, but it sounds interesting. It's about, the concern that there's an under-reimbursement level of about 8 to 9%, out there that industry feels that when it comes to the cost of care reimbursement, that there's this 8 to 9% gap nationally. But in some places in the country, like Northern California, according to this person, it's a wider gap. And so that puts pressure on commercial rates, et cetera. So I'm just interested, again, this comes to payments and reimbursements, and I know it's a very wonky issue, but as we begin looking again at how we cover more Americans and make sure, to come back to your original point, that we're reaching patients where they are there things that we need to tweak in those arrangements or be aware of that our audience may not be aware of?
Well, I think certainly, around making sure that we are advancing health equity, we are looking at quality person-centered care and affordability and sustainability, and really evaluating in our programs where there are improvements that we can make, small or large, to be able to drive those objectives. That is certainly very important.
Well, Dr. Meena Seshamani, Director now of the Center for Medicare and Deputy Administrator, thank you so much for joining us today, and we hope you'll come back.
Thank you for having me.